this segment is sponsored by Natrel. It's Breast Cancer Awareness Month, and today we're joined with plastic surgeon Dr. Danielle Andre to shed light on the topic and to discuss breast reconstruction, the truth about augmentation, and the Faces of Natrel campaign that's highlighting real patient stories. Welcome, doctor.
Thank you so much for having me.
Of course, thank you for coming. Now let's talk about what is Natrel and why do you personally recommend it to patients?
So Natrel is one of the FDA-approved implant brands, and it is the #1 breast implant brand that is selected by plastic surgeons. I think a huge reason for that and why I like to use it for my patients is that it has a very wide collection of over 300 implant options to choose from. And they offer the most comprehensive portfolio of smooth implants on the market. And it has all kinds of different profiles, 5 different ones that have minimal to maximal fullness, and then 3 different grades of gummy gels to allow for different levels of softness in those implants. So during consultations, we encourage patients to hold and compare the different gel types, and this experience really helps patients to understand the subtle differences and reinforces the brand's commitment to personalization and comfort for those patients.
Okay, thank you. What role does reconstruction play in the healing process?
So reconstruction has become really common, and it helps to empower women who have undergone breast cancer surgery in helping them restore their sense of wholeness. So according to the American Society of Plastic Surgeons, reconstructive procedures have actually risen 2% in 2024, making it one of the fastest growing categories. Advancements in surgical techniques have really allowed for a highly personalized breast reconstruction experience and outcome for patients, and surgeons are really able to recreate the breast based on the desired look that the patient wants. So whether they're just wanting what they had pre-mastectomy or something a little bit larger or smaller, we're really able to customize that to the patients.
Talk to us about the stigma around breast procedures today, and how do you address questions from prospective patients?
We're really starting to see more and more transparency in aesthetics. So both patients and public figures alike are opening up about the treatments that they choose, and this is really helping to break down that stigma around breast procedures. And patients are able to make more informed decisions about their appearance, and whether patients are desiring just an enhanced size or a little bit more fullness, Natrel really offers options to help customize that silhouette to something that the patient's going to love. So we as surgeons, we look at what's the available tissue, the body structure, their aesthetic goals, and then we can identify that profile and size that are going to work best in that patient to get them that right result.
Okay, jumping off that, how do campaigns like Faces of Natrel help inform that patient decision making?
So Natrel launched the Faces of Natrel campaign that features 9 women, and they are openly sharing their experience and their personal journey with either breast augmentation or breast reconstruction. And I think that by highlighting these stories of transformation from both the post-cancer reconstructive to patients that are just doing a little bit of self-investment after motherhood, the Faces of Natrel campaign really encourages open conversations around aesthetic choices and personal healing, and it really reminds patients that no 2 journeys are the same.
I love that. Okay, so give us that website. Where can we go for more info?
So you can go to natrel.com. They have a lot of resources available for patients.
Amazing. Thank you so much, doctor. And of course, we're going to have all this info linked up on our website, cw33.com. And again, this was a sponsored segment from Natrel.